Officials at the State House are trying to reach agreement over ways to address the growing problem of drug abuse in connection with opioids. The most recent development was the legislation approved by the House of Representatives following proposals by the Senate and Governor Baker. Among the supporters of the House legislation is a guest who works in the field of drug treatment and was a member of the opioid working group formed by Governor Baker. We'd like to welcome the president and CEO of the Gavin Foundation, John McGahan. Thank you very much for being with us, John.
Thank you for inviting me.
First off here, just talk about the increasing demand for what you're trying to do.
At every level of our agency, the demand is continuing to increase for treatment. So we operate a ATS or a detox unit in Quincy with Phoenix House of New England, and we're full, nonstop. We're full, and the clinical stabilization unit is full. Our main business, Gavin Foundation, started in 1962 as a recovery home. And we now have 3 recovery homes, 88 total beds, and we have a waiting list of 6 to 8 weeks long to get a bed in our recovery program. So the list is long.
Well, in the most recent stage of things, with the House coming out with its legislation, there is a lot of attention to one difference, and that is if you got somebody who's overdosing, they end up in a hospital emergency room. Governor Baker says, sometimes you really have to just confine them and just keep them from doing any more harm to themselves. And the House bill is more or less about trying to encourage voluntary treatment.
Right. And look, I support anything that's going to get people into treatment. So once they get into the emergency rooms, the governor's bill that he put out wanted to make sure that people actually access treatment, didn't just walk out and get no services whatsoever and be at risk. As you may be aware, there's the drug Narcan, or naltrexone, which is brand name Narcan, that people will get. Narcan will knock opiates off the receptors in the brain, for 30 to 90 minutes. So once you do a rescue, if the person doesn't get some service and continue to be medically monitored, they're going to go into instant withdrawal. They're at risk to go back out and use more substances. If they use more substances and then the Narcan wears off, now you've got a double batch and you got a real recipe for disaster, because you'll have new opiates in the system and the old opiates coming back. So they're at real risk of overdose and death at that point. So we can get them to the emergency room and get them evaluated, and the House bill calls for 24 hours to have an evaluation done in a referral and a discharge plan. So that ensures medical safety, which is, at the forefront of what we're trying to do, is save lives here. In that time frame of having to have an evaluation, they're going to see a licensed alcohol and drug counselor, a mental health clinician, somebody qualified to do the evaluation. And we're hoping that they'll bring recovery coaches into it, somebody who's maybe a peer-to-peer who can help mentor these folks and encourage them to enter further treatment from the emergency room so that they don't have to be confined.
But what's the most important missing piece here? Is it just the amount of resources for treatment, or is it something that just isn't adequately addressing the willpower needed by somebody to recover?
Well, it's important that we get into, this is really going to take a multi-pronged approach to attack this opiate addiction and addiction in general. We need to get into the schools and do prevention. We need to do intervention and get people assessed and get them into the right level of care. So whether that be a detox unit or an outpatient program or a residential program, then we got to make sure that those programs are available. We have to collect the data to be able to make informed decisions on really what we need. But the key piece to this bill is the evaluation. Have the evaluation done with a referral and a discharge plan that would become part of the patient's record. They would also get a copy of that. And with folks knowing that their loved ones are getting a copy of that discharge plan, now we can get maybe the folks that they live with and their loved ones to help encourage them to go on to further treatment.
I know we hear a lot about people who have a real health problem. They get painkiller medication and then they become addicted. But what about the younger part of the pipeline here? You mentioned the need for prevention in schools. This does not sound like people getting back injuries and getting hooked.
Well, I mean, that's part of the problem. There's no question that that's part of the problem, but addiction it's a disease of progression. So it's, it's not like if we went out and interviewed 100 people addicted to heroin that they're going to say that that's where they started. They didn't. Most of them started with alcohol and marijuana, and if we can get into schools, which this bill calls for them to have a policy around this, and start doing some prevention work, then we can cut down on the number of kids starting with alcohol and marijuana. Then they won't use those drugs as gateways to get on to the pills.
It sounds like there's also a message to parents here, because there are things that kids do in their teens, and the parents maybe did this when they were in their teens, and they kind of think it's normal. They're not happy with it, but they're not going to panic either.
Well, and unfortunately, I hear that all the time. We have an adolescent program, Cushing House in South Boston, 30 beds, always full, a demand for our services, and we get parents that are shocked that their son or daughter is in the position that they're in, and they look at it as a rite of passage. Kids will be kids, they'll outgrow it. And hey, listen, I'm not saying every kid that drinks a beer or smokes a joint is going to become a heroin addict. I'm not saying that at all. But what I'm saying is, in my experience, every young person or every person that's been involved with heroin, got a heroin addiction, has used other substances prior to the heroin. So don't think that we escaped it, or few of my kids just smoking a little grass or drinking on the weekends. I just don't think that that's a safe way to go. I think if we look at how technology in every facet of our life has progressed over the last 20 or 30 years, well, it has for growing marijuana, the nutrients that they put in, whether the special lights, all the ways that they do to make it a more potent drug, to make it more valuable. So it's not the joint that the kids are smoking today isn't the same joint that somebody was smoking 30 years ago.
Well, if nothing else, there are young people getting derailed from their education, and that's why we have the sober high schools. And I guess one of the things you're trying to do is make sure more kids who need those can get to them.
Exactly. And this bill has language in the bill that will provide that, to make it mandatory for to provide transportation from their home school or from their community to one of the 5 recovery high schools across the Commonwealth. And we think that's a good thing. And the schools are designed, I'm part of Osterguy Recovery High School, which is an ABCD program right here in Boston. The programs are designed to be full 4-year diploma schools. The diplomas come from their home school. And it's for kids who have gone away to treatment, got themselves on track, to put them in an environment and take them away from the environment that they were in and put them in an environment that's going to provide positive social contact. So we want to make sure that transportation doesn't become a hindrance to those students.
Well, another new development, the State Public Health Council wants to have voluntary regulation of sober houses, and they've been hit and miss, from what I hear. So, is this a good thing?
It's an excellent thing for the consumers out there, of people that are using sober homes. Look, people, they go through the treatment, they go to detox, they go to clinical stabilization, they go to transitional support service, they go to a recovery home that are all operated by the state but aren't licensed. They're all licensed by the state. Sober homes right now are independently owned. Unfortunately, like many other things, a few bad ones can give the whole field a bad eye, black eye. So the certification process is going to be a voluntary process with a set of standards set by National Alliance of Recovery Residents. Help design those standards, and those standards are going to make sure that it's safe for the consumer to go in, so that when they've been through all those licensed programs and now they're ready to go out on their own, that they're going someplace that you would want somebody to go, and that they're going to be run properly and provide safe, sober, supportive environment for them.
Thank you very much for being with us. John McGahan from the Gavin Foundation.